Good morning, Beaconsfield, Buckinghamshire and beyond. It's Miss Sherina Balaratnam here, Medical Director of the S-Thetics Clinic, my practice in Beaconsfield. I haven't done this in a while and I'd love to take you on a clinic tour as I set up for success this weekend. So education being the currency of our futures, lots of education on my YouTube channel, lots going on the Instagram as well, my own and the clinics, because we've just had the fantastic launches of our brand new brain device called Exomind, all across the world, from Buenos Aires to Beaconsfield to London and Italy last weekend. I want to congratulate all the teams in all of these countries on such a revolutionary device that has transformed the emotional well-being of many patients in the clinic. And yes, I have everything here myself. So come and join me as I start my day. Okay, so for today, I'm going to be starting off with some neuromodulators, meaning muscle relaxing injectables. And it's not about freezing faces. It's about relaxing muscles that are overactive. So this muscle becomes overactive as we naturally age, and that's why we get deepened frown lines. And then these muscles also become less active and become weaker, which is the cheekbone muscle called the zygomaticus major. And we know that because there's a world-renowned anatomist called Professor Sebastian Cotofana that has carried out EMG studies looking at the muscle potential and seeing what happens to them when we age. So naturally this gets more increased, and that's why this develops into a more hypertrophic muscle, and this actually weakens, which is why we also drop the cheek and the cheek fat. And then we've got the whole complex process of aging, which is all the layers, the skin, the superficial fat, the muscles, the deep fat, and then finally our bones. So I wonder if you're enjoying my new hairstyle today. Well, everyone's asking me if I've gone for a swim. I have not. I'm literally swimming in XOE. Literally swimming in XOE. So this is my 100% plant-derived exosome product, and I've had it here in the clinic for 2.5 years, from May 2023, and it has supported my hair growth and luminosity extraordinaire. We also do it as an in-clinic treatment, but these are the at-home products which I use predominantly at night. I have a serum which I apply direct, but my scalp right now is literally covered in the leave-in conditioner. So what I do in the morning like this, I literally am spraying it on my head. So I'm covered in plant-derived exosomes throughout my whole day. And I love this because it's also going to protect my hair by releasing cytokeratin P15. So exosomes has become commonplace here in the clinic. People often ask me, why haven't I gone for a human-derived version? Well, human-derived versions are fantastic. However, they are illegal here in the UK and Europe. So with this in mind, it just gives me safety, it gives me assurance, but most importantly, it gives me science in a bottle, because they're produced, they're also tested by my colleagues in the US, and the clinical data is exceptional. So we use it for the skin on the face, the scalp. We also use it during in-clinic treatments, such as radiofrequency needling, because it down-regulates 61% of the inflammatory process. What does that mean for our patients? It means that when we carry out treatments like lasers, like fractionated lasers, like RF needling, you don't go home red, you don't go home puffy and swollen, etc. You just speed through what we want, which is the collagen, elastin, and also your hyaluronic acid production, which is great.